Hey, my dear friends, you're welcome, dear listeners, and our friends around the world, in Nigeria and around the world. This is Vital Health International, a health conversation to help you eat healthy, live healthy, and feel healthy, and spend less money on doctors, on hospital fees, and on medical bills. It is my desire and our desire as we go on to help you live out your life on earth as God planned for you to live out. That's why this health conversation is coming your way. And I do hope that by the end of this program and in the subsequent weeks, you will learn a lot. You see, when you're talking about insulin resistance, sorry that we have to go back a little bit. And this is the way sometimes I describe it to some people when they ask me. I say, what happens is that it's like you're getting letters from the post office, okay? The postman is supposed to bring the letters to your home. And then when the postman, in this case is the insulin, is supposed to transport the glucose into your system. Now, when the postman brings the letters to your home and your door is locked and your mailbox is not there, so they drop the letters in front of your house and the letters pile up. It's like, so when your body is resistant to insulin, so the insulin, the energy is not reaching your body. Sugar is not reaching your body. So the letters accumulate in front of your house. So that's the way I make it so that the layman can understand it.
Yes. Yes, and that house is the bloodstream. So there will be excessive sugar in the bloodstream, which we call hyperglycemia.
Hyperglycemia, yes. And when that happens, they begin to manifest themselves in very many ways. Now, it's one of the silent killers. But before we talk about some of the complications of diabetes, what are some of the risk factors that, I know you've mentioned some of them, but for some of our listeners and those who are watching online or watching on YouTube, so what are some of the risk factors that predisposes you to, particularly type 2, because that's the one that's a lot common and that's manageable and controllable?
We would see things like a sedentary lifestyle.
Yes.
We would see things like familial inheritance.
Okay, it runs through families.
Yes, it runs through families.
Okay.
I've mentioned obesity.
Yes.
I've mentioned some medications and some other health issues.
Yes.
Not necessarily age, unless, no, that's too complicated. So these are the most common causes or the most common predisposing factors that I can think of.
Okay.
Yes.
So when you do have those things, it begins to dispose you to, and of course, she's mentioned sedentary lifestyle, particularly when you have a family history and then you are not doing anything. Now, let's begin to talk about some of the complications of diabetes, right?
I had a patient once, this was when I first started practicing. He came to me and he had a wound on the bottom of his foot, and I was like, this is a weird place to have a wound at the bottom of the sole of your foot. He said yes, that he had a nail in him and he was not aware, meaning the nerves in his feet were dead. He could not feel, and it's unfortunate because when that happens and the foot is placed on the floor, the body is not aware of the positioning of the foot. So you step on something the body does not know. You walk in a way and your toes are under this toe, the body does not know. So that leads to a lot of foot injuries. And we'll get to that about why you should see your foot doctor as a diabetic.
Yeah, that's very important. Yes. So now that you're talking about that, go ahead and mention it, because part of the treatment for diabetes is that apart from controlling what you eat, apart from controlling even your stress level too, apart from controlling how you behave, even your activity level, one of the other things is food care.
Yes, food care is very, very important. So like I just highlighted, if diabetes has been uncontrolled for a long time, one can lose sensation at the nerve endings, and you never know what those little sensations, what they do. It's just like walking and stepping on a Lego or stepping on a glass. You know, you flinch and you know there's something, but imagine if you didn't know.
That's right.
Then there's a wound there. You might notice because there are blood stains on the floor, and then you see. But then because there's diabetes and it's not controlled, there's excessive blood sugar, meaning germs will love that wound, meaning that wound will not heal, meaning it will get infected. And the infection would spread because there's blood all over the body and there's excessive blood sugar all over the body. So you need to see your doctors especially your foot doctor too, when you're diabetic, they need to check, are the nerve endings good? If the nerve endings are not good, they need to fashion up good shoes for you that'll help your feet stay and your toes stay the way they need to stay when you're walking. They need to check, are the blood vessels good? If the blood vessels are not good, then they will work in conjunction with vascular surgeons to try to open up blood vessels, and even at times getting a graft. A graft meaning like a blood vessel they can bring from other parts of your body or from a synthetic material to make sure blood reaches the places they need to reach. And at times I've said the blood and the nerve. So at times some people say they have neuropathic pain, and this is burning. It's your blood, it's your nerves crying. Yes, because the nerves are diseased, because the blood vessels are diseased, everything is diseased. And you see some people have amputations. This is something that can happen to uncontrolled diabetics.
So, and that's scary. Now, one of the scariest thing for me, which I tell patients when I notice that they're not managing, they are eating anyhow. Some people say they love gari, they love to drink gari. So they will drink gari at any time. And you see them, they have high blood pressure, and sorry, they have high sugar. And of course, high sugar sometimes been associated with high blood pressure too, and lipidemia, you know. And then they also want to eat pounded yam, you know. Some people love, I had an uncle who died from diabetes, and I remember, you know, going to visit him, and he wanted me to buy him some medications. And he was eating his food. He said, "Oh, this pounded yam, I love pounded yam. I love pounded yam." I was out of the country when I heard that, you know, his condition had gotten worse, and he passed on. Now, one of the scariest things that I tell patients, particularly, you know, some of my folks in church and friends who I know, I tell them, if you don't take your treatment, you know one problem you're going to have? You go blind. You go blind, and somebody will have to lead you around, right? And you don't want that.
Yes, you can't watch TV. No Instagram. Yes.
So it's important. You're taking care of your blood pressure. You're taking care of your sugar level, and you're taking care of every part of almost all the organs. Diabetes is one of those diseases too that can affect almost all the organs of the body. You know, from head to toe, your brain, it can affect your liver, it can affect your heart, it can affect your pancreas, it can affect your kidneys, and on and on and on like that. And that's why it's important for you to deal with this high sugar. Now, just before we close out for the day, one of the side effects of diabetes, and I know men would like to hear this, is erectile dysfunction. Because some people have issues with erectile dysfunction, and they've not been able to connect that dot. What do you say?
Well, so we talked about vascular issue, peripheral vascular disease, and meaning blood vessel disease in the periphery. So also the penis. Blood gets to the penis, and this is why the penis can be turgid. Yes, enough for penetration. So if there's an issue with the blood vessel because it's occluded, or because enough blood is not getting in, or it's not, yes, diabetes can cause all this. So if enough blood is not getting there to keep it turgid, that's erectile dysfunction.
Yes.
That's erectile dysfunction.
So that's why you have a problem. And women, so some of the men who have erectile dysfunction and they've not allowed you to follow them to the doctor, please follow them to the doctor and have a healthy conversation so that you can deal with the problem. Because this can be managed. Depending on treatment and lifestyle modifications, this thing can be managed so that there is health at home and there's proper relationship, intimate relationship when that happens.
Erectile dysfunction is a whole other topic on its own.
Yes.
Because you said the diagnosis, in my clinic, I will administer something called the SHIM test.
Yes.
It's the sexual health inventory of men. It would help classify, it's an objective screening, so it's not just subjective, oh, I'm having issues. It's an objective screening that tells us, is it mild, moderate, or severe erectile dysfunction? And then we can still talk about, oh, how do we manage it? How do we diagnose it? Do you know that there are penile Dopplers we could do to diagnose issues with the blood vessels, and maybe vasodilation would help. Yeah, so there are lots of things. You need to work with your doctor. It's not something that you should keep quiet. It's not a disease as you get older. No. And data shows that, I was very intrigued, 40% of men over 40 have some form of erectile dysfunction.
Okay.
So it's something that is prevalent, but people don't want to talk about it because it's a
It's
stain
shameful.
with their masculinity. But please feel free to talk about it. You can talk about it in privacy.
Yeah.
You can request some private moment, but talk about it because remember, it's blood vessel. It's getting to the heart. It's getting to the brain.
Yeah.
The same disease.
The same disease. So, and that's why tell MD is very important, because you have the benefit of privacy, and some of you don't want to talk about it with your doctor because you don't want to go out someday in a party or a function and you see this doctor there, you start feeling uncomfortable, But you can call Tell MD, like I said, they are foreign trained physicians and they will attend to you. And once again, I'm going to give you the phone number 0707 660 7330, 0707 660 7330, and you can send them an private Instagram message. You can even disguise your name, use an aliases at TellMDNG, and of course LinkedIn, you Tell MD Nigeria. Now, what we're talking about, we're talking about diabetes. Now, generally, what's the treatment? Apart from lifestyle modification, both from a preventive standpoint, particularly if there's a familial history, there's a family history. So what's the treatment? Now, the diagnosis has been made. The fasting blood sugar above 126, 150, 180, sometimes some people 200. I heard of a patient who died. My wife was telling me of a patient who came into the hospital. The random blood sugar was 600, and he had passed on, he had a heart attack and he died. So you've made that diagnosis, the blood pressure or the A1C above 6.5, 7 plus, 8, 13, as the case might be, over a period of time. So what do you do with this patient?
So it depends on the state you're in and where you're and what the cause is. I always like to know the cause because when you know the cause, then you can fix the cause, then it helps with the treatment.
Okay.
So if it's something like it's a type 1 that is insulin deficiency, you know you have to give insulin because the insulin is actually low. But
even in that case, diagnosis is made much earlier in life because the young person.
Yes, but at times in older people.
Older people too,
yes,
oh really?
I had a friend who had an issue with blood. She was actually anemic and she had pancreatic infarction.
Okay.
Yes.
How old was
she? Was
over 30?
50s.
Oh really?
Yeah.
Type 1?
Yes.
Oh, interesting.
And then autoimmune disorders too.
Okay.
Yes. So that can develop at any age.
Okay.
Too.
Yeah.
Yes. Yeah. So for type 1 diabetes, this is a situation of lack of insulin. So using insulin will be the treatment. But for type 2, where we have insulin resistance. So we want to also treat what is causing the insulin resistance because the medications just urge the insulin to be used by the tissues, some of them.
Yeah.
So we want to treat what is causing the insulin resistance. So if it's obesity, we'll be talking to you about losing weight. With weight loss, insulin resistance reduces, and this helps with the diabetes.
Okay.
And also, we would give medications. There are so many medications. They can be oral tablets, those you use once a day, those you use multiple times a day, and there are some injectables too, and some people even use insulin. So there are different injectables. I was looking at them. There are so many these days, DPP-4s, SGLT2s, GLP-1s. Yes, we have fancy names. Some people have heard of Ozempic, but not for the use of diabetes, but it's actually for diabetes too. The Monjaros, you have the Victosas, you have the Trulicities. There are so many medications.
Now don't listen to this medication and then go out there and use ChatGPT to get something for yourself, okay? So I know some of you are Dr. Googles, so please, you still need a physician. Yes. That's why Tell MD is very helpful. They would help you in terms of, they'll make recommendations and then do the labs and follow up with the labs.
Yes.
See, when I run this thing on a regular basis, I know patients who, number one, the doctors did not even order the right labs. Number two, even when they ordered the right labs, all they did was they collected their money. They knew what the condition was, but they didn't tell the patients these conditions. So when I told the patients, go back and ask your doctor about so, things changed because some of the patients were actually close to death and they were spending this money in the hospital. Now, Tell MD will not do that. one of the things is they will help you order the right labs so that they make the appropriate diagnosis, and then they will give you the right treatment.
Yes.
My friend, Tell MD is somebody and some agency you need to trust. You need to trust the Tell MD team. Dr. Toyin and her team of doctors would help you. So don't just take these names and say, you're going to you're going to talk to Dr. Google or ChatGPT and get this treatment. Now, when we talked about even when we talked about hypertension, we also did not talk about the treatment, because there are some medications at different levels that you have to take, and then of course, but you emphasize the compliance to these medications.
Yes. So also in diabetes, there has to be compliance. And I like that he pointed out that you shouldn't go on Dr. Google, because oftentimes to prescribe a medication, I look at everything with a patient. Does this patient have high blood pressure? Does this patient have heart disease? There are some diabetes medications that are good for the heart, that are good for the kidneys. So we take that and put all that into factor before prescribing. And there are some medications that we give, but we need to see you back in not so long after to be sure there are no side effects. And there are some medications that you can't use because there's a family history of this. You can't just take it. And there are some medications that might cause some side effects that you do not know, but your doctor needs to know. So before you start a medication, please let your doctor know. Talk to your doctor about it. Let them prescribe it and let them monitor you. So for something like diabetes that I said is a chronic health issue, meaning it's for a long time, you need to have a doctor who sees you chronically.
On a regular basis.
On a regular basis and follows up.
So let me ask you, I know you mentioned it, but just for the purpose of those listeners who are just tuning in, by the way, Dr. Joe Takon, Vital Health International, I'm talking with the CEO of Tell MD. This is a health conversation, and their goal is to walk with you through life. Just hold you by the hand, more so to speak, and they will walk with you, look at your health record, look at your health condition, and advise you. So we're talking about patients taking these medications and just not bothering about the complications. How do they deal when they take some of these medications and they have complications?
I'm always very upset, actually, because to me, I gave you something, you didn't turn back around to say, oh, it's working, it's not working. So you have to know first then, is this medication working for you? Because it might be working, but it's not enough. And it might not be working, and you're still using it because somebody gave you this medication. But you have to go back and let them see it's working, and it's working, but I'm doing this. Like some of the new medications might work for you. It might even help with weight loss, but they might cause other complications like acid reflux. They might make you throw up. It might make your life miserable. And some of them might even cause a situation called pancreatitis. So you have
What's pancreatitis?
That's inflammation of the pancreas.
It's not a great...
Sorry?
How do I say that? It's not a local word.
No, it's not a local word. I didn't just bring it out of thin air. It's a thing. Doctors like fancy big words to confuse people. But it just means that the pancreas, which is an organ in the body, it's one of the biggest organs that produces hormones. It's like, what do they call it? It's a gland.
And that's what produces the insulin, as a matter of fact.
It produces insulin. So when that gland is inflamed, it's called pancreatitis. And some of the medications we use could actually cause that. And some of them also could go all the way to causing things like thyroid cancer. So you have to talk to your doctor before you start a medication. And the doctor has to look at you, look at your family history. Do you have any other issues? Do you know that there are some medications that are out there now, even though they're for diabetes, they help with heart disease and kidney disease?
That's right. They help with other conditions.
So some of those medications. So talk to your doctors. Side effects or no side effects. Follow up with them and let them know. Don't say this doctor gave me this and I'm throwing up. I'm not going back. No.
That's very good. Thank you so much, Dr. Tony. That's very helpful. So compliance of medication essentially is it's helpful. Number one, you have to be compliant, because most times when doctors prescribe this thing, when you're not compliant, some of the side effects that you experience and some of the complications, the disease complication that you experience is because you were not compliant. And it's also important for listening to her, you realize that it's important for you to allow for follow-up. That means you get a medication And sometimes they will tell you, I want to talk with you again in 1 month, in 2 months, in 3 months, as the case may be. And that's a good thing about Tell MD, because the fact that you subscribe gives you the opportunity for follow-up, where you're not going to pay anything again within your subscription package. That allows for follow-up, and it also allows you the benefit of seeing the same doctor who follows you up with compassion and who is genuinely interested in your case. My dear friend, we're running out of time today, and we're going to continue this same conversation. Same time next week. I would like you to tune in or go back on YouTube and watch the episodes so that you can get yourself properly educated. And the platforms, how you can reach Dr. Toyin and her team will be provided for you on the platform on YouTube and the other platform that will post this. But I want you, same time next week, to tune in on this same radio station for another health conversation with Dr. Toyin and, of course, your host, Dr. Joe Takon, Vital Health International. Before we close out for the day, I'm going to give you the phone numbers again. 0707 660 7330. 0707 660 7330. I would like you to get in touch, call, or send a text. It accepts WhatsApp, right?
Yes.
Yeah, you can send a WhatsApp, you can call, you can send a text. If you call, because again, you can call 24/7. That means any time of the day. I remember many of you used to call me 5 a.m. in the morning, 6 a.m. in the morning, and I used to tell you, don't call me until it is past 4 p.m. Nigerian time. But this one, you can call any time of the day, or you send a text. When you send a text, somebody will follow up with you to ensure that you get the best attention. We're going to close out for the day. Yeah, go ahead, please.
So you can go on our website too.
Yes.
It's telmdng.com.
Okay.
And if you click on the website, if you open it, you will see there's an icon for WhatsApp, and you click on it, and it takes you straight to the chat where you can chat with a nurse, or you can chat with whoever you need to chat with, and they can get in touch with your doctors. But if you go on telmdng.com, you can click on the WhatsApp icon. Or if you heard the numbers Dr. Joe said, you can go on WhatsApp and you can have a robust chat with a nurse.
Okay, that's great. So the website, telmdnd.com, telmdnd.com. We are going to close out for the day.